Introducing the all-new Corolla.
Guam Memorial Hospital remains in debt by roughly $22.5 million. The $25 million loan they're seeking was authorized by the Guam legislature. The Bank of Guam was the only lender to respond. GMH Administrator Joseph Verga says it's critical for the hospital's financial health. Even though the feds have lifted the garnishment on GMH's Medicare reimbursements, Verga says that garnishment could resume unless the debt to the federally controlled Perry Point Medical is paid off.
If we don't pay Perry Point by the end of December, we risk at the beginning of the year the garnishment kicking in and taking effect again.
So approval of this loan is critical.
So the approval of this loan is critical now.
The loan proceeds will be used to refinance a current hospital loan of about $11 million. The remaining $14 million will be used to pay off Perry Point and other vendors. Verga says that he will urge the GMH board to approve the loan tomorrow night.
We're $22.5 million still in debt. So the $14 million or so is not going to cover the whole debt, but it's going to go a long way to us at least paying down half and avoiding the garnishment and us being able to take us off of low credit holes and going back to restoring faith among our vendors. So we still have work to do even after that, but this is really critical that this gets approved in the time frame that I'm requesting now.
If the GMH board does approve, the GITA board will be the next hurdle. They meet next Tuesday to consider the same loan.
Very optimistic that if all of this falls into place the way it needs to, we will get the funds by the end of December and be able to pay off Perry Point and some of our other critical vendors.
Another critical issue affecting GMH will also be decided at next week's GITA board meeting, and that is the qualifying certificate being sought by Guam Regional Medical City for the new hospital nearing completion in Dededo. Critical because of a new law, Public Law 32-72, a measure introduced by Senator Rory Respicio, which directs any tax revenues from the new hospital to GMH to help the public hospital cover the ongoing costs to vendors for medicines and other supplies.
This is probably one of the most significant pieces of legislation, concrete legislation to help the hospital in a concrete way with a sustainable source of revenue in a very long time. So as I said, I mean, I really want to thank the sponsor, Senator Respicio, and the co-sponsor, I think it was Senator Rad, if I'm not mistaken, and certainly the entire legislature for voting it, and Governor Calvo for signing it right into law.
The rub, however, is this. Tax revenues from the new hospital may be limited or non-existent for years, depending upon the nature and amount of tax exemption that GITA approves for GRMC's QC request.
Of course, it will affect because in terms of the amount of taxes that they pay, then will affect the amount of revenue that comes to GMH.
You don't know how much?
No. Again, I understand it's on the board for GITA to determine exactly what tax exemption they're going to get. So that it will be important to keep an eye on that, because based on that we will be able to at least quantify and get an idea of how much revenue we might be able to expect.
Kevin Kerrigan, PNC News.